My name is Nicholas Lovell. I'm a lawyer at Middleborough and Stevens in Owen Sound, and this is a presentation focusing on the Health Protection and Promotion Act and public health's role in the COVID-19 pandemic. So the first thing I'd like to talk about is what the actual Health Protection and Promotion Act is. It is the legislation passed by the province of Ontario that creates the public health authorities in the province. It establishes the governance model and jurisdiction for each public health unit in the province, and it grants the health unit authority over health hazards, small drinking water systems, inspections of food premises, inspections of tattoo and jewelry stores, communicable diseases, public pools, and a whole host of other smaller things that everybody lives with day to day but doesn't necessarily think about in their lives. So it also creates a hierarchy of authority in the province, and that hierarchy is that the Chief Medical Officer of Health for the province is in the first position, and then the regional boards of health have jurisdiction below that. They hire the Medical Officer of Health, and then each health unit has their own internal hierarchy from there, which sets out their own delegations of authority inside the organization, and they all look slightly different, but all start with the Medical Officer of Health. So the Board of Health exists in each geographic region specified. In our locality, it's Grey Bruce, and they are responsible for the finances, so things like seeing to the banking, hiring of auditors, and those practices, appointing officers to run the health unit, and ensuring that the health unit carries out its obligations under the Health Protection and Promotion Act. So they have ultimate responsibility for that. And then their biggest task is appointing a medical officer of health. So the qualifications for a medical officer of health are that they must be a physician, they must possess any other qualifications or requirements as prescribed by regulation, and then when a board of health actually selects a medical officer of health, the minister has to approve that selection as a last check on the system. The medical officer of health has prescribed responsibilities in the area that they serve, and they are to report directly to the board on matters of public health concern and the programs that the health unit is responsible for running. They are to supervise and delegate to the employees of the health unit and are the ultimate supervising authority for all of the staff at the health unit. They are responsible to the board for the management of the programs and services, and their authority is only in the area that they are appointed to serve. So for our medical officer of health, his authority is only in Grey Bruce, not in any adjoining counties, and the same with all of the other health units. Their jurisdiction ends at their county lines for the most part. So the Chief Medical Officer of Health is a single person appointed for the province, and they have authority over the boards of health, particularly where it concerns issuing directives. And they have the ability to issue directives where there exists an immediate risk of provincial or national or international public health event, a pandemic, or an emergency, and that those directions are necessary to support or coordinate responses in situations where that directive authority exists. They may also make directives with respect to infectious diseases, health hazards, public health emergency preparedness, and other matters. So ultimately, the Chief Medical Officer of Health can issue directions to the Board of Health that must be carried out by the region. So of all the authority that the health unit has, right now, probably the most important one is the authority over communicable diseases. So a communicable disease under the Health Protection and Promotion Act is any disease as designated by the Government of Ontario. And for right now, novel coronaviruses are a communicable disease, which is where most of the authority during this pandemic is coming from. So the Medical Officer of Health has explicit powers to deal with these communicable diseases, and they can issue orders where they are of the opinion that a communicable disease exists, may exist, or there's an immediate risk of an outbreak of a communicable disease. that this disease presents a risk to the health of persons in Grey Bruce for our circumstances, and that the requirements under the order are necessary in order to decrease or eliminate the risk of health presented by the disease. So this is a very broad enabling power. There does not actually need to be, in our case, any COVID cases in Grey Bruce for there to be the potential for an order, because there is always the possibility that it may come here. COVID-19, I think fairly self-evidently, is a risk to the health of the residents of Grey and Bruce County. And so the only limiting factor really is that these orders are necessary to not necessarily eliminate the risk to people, but also to decrease the risk to people, since eliminating risk is almost an impossible task at least on a scientific level. So what can orders do? Orders explicitly can include requiring the closure of premises, posting notices that premises are closed, requiring anybody that may have a communicable disease to isolate themselves, so quarantine themselves, requiring cleaning and disinfecting of premises, requiring the destruction of items or things specified that may present a risk, requiring persons to submit to medical examination, placing themselves under care of physicians, or requiring them to conduct themselves in a manner such as to not expose another person to a possible infection. But the biggest thing about this section is this list of specific powers leads off with the same thing that I have on my slide, which is that an order may include these things, but is not limited to these things. Really, the limitation on an order is going to be whether or not it decreases or eliminates the risk of the disease to people in Grey Bruce. There we go. So in addition to this authority to manage the pandemic, the health unit has an obligation for other jurisdictions and other entities in this case to report communicable diseases to them. So physicians or members of the College of Chiropractors, dentists, nurses, pharmacists, optometrists, naturopaths, and any other like professions have an obligation to report to the medical officer of health when they are of the opinion that a person has or may have a disease of public health significance, unless they are a patient or outpatient at a hospital. And that exemption doesn't prevent the reporting requirement, it just changes the obligation to report from the actual practitioner. So any doctor that's aware of a possible case has to report that to public health when they become aware of that or have that suspicion. So hospitals, one of the exceptions is anybody who is a patient or an outpatient at a hospital. Hospitals, the administrator of the hospital shall report to the medical officer of health any patient or outpatient that has or may have a disease of public health significance or a communicable disease. So all hospitals must report all suspected cases of COVID-19 to the medical officer of health. So the only difference is in this case, it's no longer the physician or the nurse that has to make that report, but the hospital administrator for the entity as a whole. Very similar to hospitals, schools are required to report possible cases of COVID-19. And in this case, it's the principal who has to report when they are of the opinion that a student in the school has or may have a communicable disease, and they have to make that report as soon as possible after that opinion is formed. So they should be reporting to public health as soon as they have that opinion, or as reasonably delayed as need be, which is probably a short period of time in this case. Institutions. So institutions are also required to report possible cases or confirmed cases. In this case, it's the superintendent of the institution that will make the report to the medical officer of health in the health unit where they are located. When they are of the opinion or a person has lodged information in their records that they have or may have a communicable disease. And they will, as with other administrators, report this as soon as possible after the records have been made in their logs. So this leads to the natural question, what exactly is an institution? So institutions include premises that have been approved under the Child and Family Services Act, children's residences, child care centers, supported living residences, homes for special care, long-term care homes, psychiatric facilities, correction institutions, so jails, detention facilities, private hospitals, community health facilities, places where young offenders are remanded, and any other prescribed place. And then, as with other parts of the Health Protection and Promotion Act, the important catch-all, which is any other place similar to the ones that have been named. So effectively, any widespread institution or regulated area with multiple people living in it is required to make a report to public health about possible cases. So it is the superintendent that must advise public health, which also poses the question what exactly a superintendent is, and that is the person who at the time they are there is in direct and actual superintendency and charge of the institution. So it's really the highest ranking person working for that institution is considered the superintendent, be that an executive director, CEO, or whatever title they may possess. So as there is a reporting obligation for institutions, the medical officer of health also has an ability to make orders against institutions or hospitals to take action specified in the order for the purposes of monitoring, investigating, or responding to an outbreak of a communicable disease. As with other orders, there is a prerequisite that the medical officer of health has to have an opinion on reasonable and probable grounds that an outbreak of a communicable disease exists or may exist at the public hospital or institution, that the disease presents a risk to the health of the persons therein, and that the measures are necessary to decrease or eliminate the risk to health associated with the outbreak. So the determination of whether an outbreak exists is something that is made solely by the medical officer of health in light of the evidence that they are considering and have reviewed for things like long-term care homes and hospitals. So we've covered the obligations and the authority that the health unit has and institutions have. With that comes potential offenses for breaching this act. So relevant to today, the offenses include failing to obey an order made by the medical officer of health, failing to report a communicable disease by an institution or person, and obstructing the health unit in its function and role in this pandemic. So that leads to what is obstruction. And obstruction is defined as no person shall hinder or obstruct an inspector appointed by the minister, a medical officer of health, a public health inspector, or a person acting under the direction of the medical officer of health, lawfully carrying out their power, duties, and directions under this act. So to help with that, there is the ability for the health unit to secure a warrant, which is a court order compelling the cooperation of named individuals or institutions. And these explicitly include the ability to seek a warrant where you've been denied access or entry to a premises, you've been instructed to leave a premise before you've completed your investigation, you've been obstructed and there's a refusal to cooperate, or they've refused to produce anything, plant, animal, for examination, investigation, testing, or inquiry. So that helps define what is obstruction. These institutions and individuals are obligated to cooperate when public health is performing an investigation or an inspection of a site. So where there's been this denial, These warrants that you can obtain are available where on reasonable and probable grounds there is a belief that it's necessary to enter into or have access to, through, or over a premises, to make examinations, investigations, tests, and inquiries, to make, take, or remove samples, copies, or extracts related to an examination, investigation, test, or inquiry, or to do any other such thing necessary to exercise your powers and authorities carrying out your responsibilities under this act. So it's a very broad authority that can include compelling organizations to produce records to public health, allowing access, examinations, taking samples, and those things. So where an individual or an institution has violated the Health Protection and Promotion Act, there are potential penalties. So the fines for an individual are up to $5,000 for each day of non-compliance with the Act. And for corporations, it's $25,000 per day as a maximum fine. In addition to this, the Ontario government has recently specified penalties for violating orders that are made by the medical officer of health. And if they're issued as a ticket, so the same as a parking ticket or speeding ticket, the fine is $750. The other potential exposure that institutions and individuals have is personal liability. And this is where the Health Protection and Promotion Act becomes one of the most, I don't want to say authoritative, becomes one of the broadest acts with the highest potential for court action, which is personal liability. So in Ontario, normally personal liability is very limited for individuals acting within their corporation, engaging in their business. Here, first, the reporting obligations for institutions are on a specific person. So if an institution doesn't make a report, it is the superintendent or administrator that faces a potential penalty. Otherwise, there can be both liability for a corporation that doesn't, or an institution that doesn't follow an order, and individual employees. And that personal liability exists where they're a director of the corporation, or they're an officer, employee, or agent who in whole or in part is responsible for the conduct of that company that gave rise to the offense. So if an institution isn't following an order, not only can the institution be fined, but all of the individuals that acted on that non-compliance can face penalty as well. And their only way of avoiding that where they're involved is if they can satisfy the court that they took all reasonable care to prevent the commission of an offense. So if there is non-compliance by a corporation, individuals who are involved have to prove to the court that they did everything to prevent the offense, and not the other way around where the health unit would have to prove that they were necessarily responsible for this.